why should a hospital system use direct to meet the CMS ADT condition of participation?
I don't see any other opportunity. Just kidding. It's a huge opportunity with a network that's already been established nationwide. Again, it's the largest network that you see in the United States, already being effectively used. I think we've passed a 2 billion transaction mark here recently in terms of the number of the transactions going over the network. So this is where you're going to take the opportunity to meet healthcare where it's at. From the smallest provider, even paper-based providers could receive event notifications through portal tools and so forth, all the way up to the largest health system. All of them have this technology. All of them can take advantage of the use of direct messaging. So it makes the most sense. If we're thinking about the impact to the patient and empowering our care teams, direct messaging is the most obvious option for delivering event notifications.
I think you have to put your practical hat on and just look at what we're up against to meet these timelines of these mandates and say, what's really possible? What's a feasible option? And, you know, we all are watching what's going on with FHIR and the use of new API strategies, but this is still a future, and it's not a proven technology that we can capitalize today. And we can capitalize on direct trust today. Direct secure messaging is available. It's a hugely scalable technology that can have the kind of impact that our nation needs for these initiatives. And it's flexible to work for everyone, not just groups that can process more sophisticated V2 or XD type messages. This is bringing the technology to a place where it can also support simpler workflows built around manual review and paper-based transactions.
I think Lisa brings up a very good point, is that the opportunity with FHIR in the future also exists with direct messaging. So it's absolutely future-proof to consider that as an option in the future. But today, this is where technology is at. And most EHRs are designed to handle push-based workflows, to Lisa's earlier discussion, within their EHR. And a push-based workflow has a lot of impact within the EHR, and you have to make sure you've got the tools already embedded within the workflows to allow for something to come into your system and to come in effectively, and what you're going to do with it. Again, it's an infrastructure that already exists, and with some improvement to that infrastructure, we can see this thing really take off.
The opportunity to get started right now is, I think, one of the biggest things, Anupam, because we don't have to wait for FHIR to get started. By getting started today with the technology that we have, technology that works now, it's the opportunity to make sure that all of these other aspects of the workflow get dealt with. We have the opportunity to improve our governance decisions about how we're handling the information and gathering consents to access and make the flow work from a governance point of view. We have the opportunity to upgrade our business processes and think about our technological workflows. We can do all of that work with the technology connection being over direct, and then all that work will already have been done. That as connectivity via FHIR becomes available, those other gating factors will already be more mature and more ready to take advantage of newer technology.
Fantastic. Thanks, guys. This was actually wonderful.